Okay, so in this recording, we're going to talk about another role of the RN, which is health promotion. Health promotion is a really big umbrella, and there are a lot of nursing activities that fall under health promotion. One of those activities is screening. That might be with lab or diagnostic tests. Screening tests are not typically the lab tests that we're using when someone's in the hospital or they present to the clinic and we're trying to diagnose a problem. This is more like the labs or the tests that we do for wide populations to detect a problem. So blood pressure screenings, or we're going to do a hemoglobin A1C on every patient that meets certain risk factors, or we're going to start checking lipids on every patient at a certain age range. So those are the screening tests. We also use history for screening. So when you're taking the family history or the patient's history, there are some screening questions in that history as well. That's going to be things like, do you have a history of respiratory difficulties? Do you have a history of cardiac disease? Another health promotion activity that nurses often perform is counseling. Counseling is going to get a little bit beyond the scope of this lecture and this class, which we will talk a little bit later about communication and therapeutic communication. But counseling is a particular form of therapeutic communication in which the nurse or another counselor is helping a patient to work through challenges. So counseling might be used to help patients who are trying to stop smoking, who are trying to change eating and exercise habits, who are struggling with depression or anxiety. But again, it's a little bit beyond the scope of this lecture or this class. Another health promotion activity is disease prevention. And you're going to need to note this. You're going to need to get out your notes and write this down. There are 3 levels of disease prevention. And you're going to have to kind of suspend your make sense for just a minute, because when we talk about prevention, we typically think about, I'm going to keep this from ever happening. That's actually the primary level of prevention. So primary prevention is, I'm going to keep it from happening. Secondary prevention in health promotion terms means I'm going to catch it early and try to keep it from getting worse, okay, or try to prevent complications. Tertiary prevention in health promotion terms is, I'm going to help this patient recover from that problem so that they can recover as much, to prevent long-term disability, to try to recover as much function as possible. So let's apply this primary, secondary, tertiary model to a couple of processes. So when we talk about, say, someone who's having a heart attack, what are some primary prevention interventions for heart attack? What things prevent heart attack? Well, that might be things like cholesterol screening so that we can treat cholesterol. That might be things like managing heart disease. That might be if we discover a patient, or if a patient is discovered to have heavy deposits in the coronary arteries, they might have a heart cath in order to prevent that heart attack. So primary prevention is to keep them from ever having the heart attack. Okay, so back to our heart attack. What does secondary prevention look like? So secondary prevention would be interventions to help that patient recognize and get help for that heart attack immediately. So that's going to be things like public education about what heart attacks look like. That's all of the things on social media and billboards. If you have chest pain, go to the ER. Indigestion and vomiting can be a sign of heart attack. Go to the ER. So all of those help people recognize it early so that we can manage it. Another piece of secondary prevention is making sure that healthcare professionals recognize those signs of MI early, because historically, when people had MI that presented differently from crushing chest pain, a lot of them are sent home to have their heart attacks and die. So secondary prevention, a lot of that is about education. What does this look like? And then what am I going to do right away to fix it? So another piece of secondary prevention for that MI is to get that patient to the cath lab. What's the time frame we want our patient to be in the cath lab from the time they hit the ER door till the time they get to the cath lab? Because time is heart muscle. Okay. Tertiary prevention is cardiac rehab. That patient has recovered from their MI because we got them to get to the cath lab. And now they're in cardiac rehab to decrease their future risk and to recover function. Okay. So I want you now to pause the recording for just a minute. And I want you to work through what primary, secondary, tertiary would look like for something like colon cancer. Okay, so you've restarted your recording, so I think you have your answers. So if we look at primary prevention for colon cancer, that's going to be things like eating lots of high fiber foods, because those are known to decrease the risk of colon cancer. There are foods that increase the risk of colon cancer, so avoiding those fatty foods and processed meats, things like that, that increase the risk. Those are primary prevention. Why is screening not a primary prevention for colon cancer? And that's because it's not a primary prevention for colon cancer because it's catching cancer that's already there. Okay, so secondary prevention is catching what's there and treating it early. So secondary prevention for colon cancer is going to be colon cancer screenings, going to get a colonoscopy. There are actually some new screenings that are coming out that for low risk people that may help space out the time between colonoscopies, which would be awesome. Tertiary prevention for colon cancer would be this patient, we've caught it early, it's been treated. Now, what are we going to do to help that patient, prevent that patient from getting colon cancer again? Okay, so there may be medications, there may be follow-ups, but we're going to want to advocate for some lifestyle changes for sure. Okay, so I think you kind of have that concept down. Now we're going to look at another health promotion activity. And this one is a big one. This is one that you as an LPN have participated in. Paramedics, you've probably participated in this too. Okay, this is health teaching. The basic principles of health teaching. Patients come to us with previous life experiences. Patients are not blank slates. They have already had lives before we see them. If they haven't, their families have. And so if we use those previous life experiences as a jumping off place for our education, it's going to help them understand a lot better what they need to do. Another basic principle of health teaching is that adult learners are motivated to learn if they believe the learning is relevant to their lives. Adult learners don't just randomly want to know about how to control blood pressure. They want to know that if they believe that it is relevant to their lives. So sometimes the first step is helping them understand how controlling their blood pressure is relevant to their lives. Adult learners respond best when they trust and feel respected by the teacher. This one should step on some toes. How many times have you seen a patient who is talked down to? You've seen a nurse or a doctor or someone talk down to a patient. If you are trying to learn something, does it help your learning for the teacher to talk down to you as if you are stupid and don't know things? When you treat your patients with respect and you develop rapport and trust with them, they learn better. Adult learners have learning styles, but they may have developed methods to compensate in weaker areas. So adults may actually know how they learn best. You can ask what helps you learn things best. Do you need to be hands-on? Do you need to see it? Do you need to hear it? Or do you use a combination of those things? We should always, when we're doing health teaching, we should always verify understanding by asking questions. We want to ask the patient to explain it back to us, or asking them to demonstrate skills back to us. If we've taught them a hands-on skill, we want to have them show us that they know how to do it. Written materials are best as reinforcement. Way too often, the only teaching we have time to do is print some stuff out and hand it out as they walk out the door. People don't always even look at that. When they do, they may not understand it. And a lot of it is based on the assumption that they can read English at a level that some people really cannot. So those handouts are better as reinforcement. It's better to sit down and teach the patient and then give them a handout. I know you're not going to remember all this. Here it is in writing, so that you can go back and consult this. We want to teach at the patient's level of health literacy. What does health literacy mean? This is an example. My health literacy is pretty high. I've been a nurse for 28 years. There are some, there actually are a lot of areas of healthcare that I don't have experience in, but my health literacy is high enough that if you explain that to me, I'm probably going to understand it. My mechanic literacy is very low. I have some tiny bit of understanding. No, I really don't. I have some tiny bit of understanding about how a few of the parts of my car work. Okay. Sometimes I can identify what general system a problem is in. I could tell you, I think this may be an electrical problem, or I think there's something wrong with the cooling system. That's about it. Okay, my mechanic literacy is low. That's not what I do. So you want to evaluate, you need to assess your patient's health literacy. What is their understanding of health? So that we're teaching at the level that they understand. We want to also use developmental principles when we're teaching children or developmentally disabled adults. So you're going to learn this semester about the stages of development. If you have not all had developmental psych, you will have it by the time you go to this fall, and that goes in a lot more depth about those stages of development. That's not just things we have you memorize to get through nursing school. Those things are relevant. The developmental stages are going to help you be able to teach your patients how to care for themselves. What are some methods of teaching? Lecture is efficient with groups. We can get a lot of information to a lot of people all at once. But it's difficult to assess individual learning, and we really don't retain a lot just from lecture. Discussion tends to be more effective at helping us retain and understand material. Simulation, you're all familiar with simulation. You've used it in training before. Independent study works best for some people. They really need to sit down and spend time alone with the material to get it, to understand it. Demonstration and return demonstration is best for psychomotor skills, those hands-on skills. Practicing something until it's muscle memory, and role playing can also be helpful. When we talk about teaching, it is in the RN scope of practice to initiate teaching. It is in the LPN scope of practice to reinforce teaching. I am very confident that as all of you who are LPNs have been doing primary teaching with your patients, because it's just not feasible for that to always be done first by an RN, but you need to understand that as an RN, you're going to be responsible for that teaching, okay? I think that Healthy People 2020 goes back under health promotion somewhere. We'll look at that in a bit. That's the end of this recording. We're going to come back and we're going to talk about some other roles of the RN.